So this is the right superior pulmonary vein and then the right inferior pulmonary vein. So 4 inflations in 4 pulmonary veins, so generally leads to good isolation. However, in challenging anatomies, the procedure can become slightly more complicated. So this is the voltage map. You can see here, this is the pre-ablation. The purple color indicates healthy myocardium. So you can see the healthy myocardium, myocardial sleeves extending into the pulmonary veins. And this is post cryoablation. You can see that all the myocardial signals are disappeared. So the veins have been clearly isolated except for a thin segment in the posterior wall. So cryoablation gives a durable pulmonary vein isolation. So some of the unique features of cryoablation is that there is something called as cryoadherence. So once we freeze the balloon, within a few seconds, say 20 to 30 seconds, there is ice formation around the cryo balloon, so which tightly adheres the cryo balloon to the pulmonary veins. So stability is achieved by freezing itself. So you don't have to hold the catheter. So this is something which is a challenge with RF ablation, getting a good stability during ablation. However, with cryoablation, intrinsically the balloon becomes stable and fixed to the pulmonary veins because of ice crystal formation around the balloon. And then, as I already said, you can freeze to minus 30 degrees and cause reversible injury and see what are the effects of cryo mapping. So if you are close to a critical structure, such as a conduction system of the heart or the His bundle, for example, for a patient with the para-His and axillary pathways, you can always cause reversible suppression and see, that is minus 30 degrees of freezing. If it is successful without any adverse effects, you can freeze to beyond minus 40 degrees and cause irreversible damage and successful ablation. And then another important feature of cryoablation is that it is generally painless and patient tolerate the procedure very well, and post-ablation also patients have a better quality of life. So finally, a brief discussion on pulsed field ablation, which is the newest modality for AF ablation. So while RF ablation and cryoablation are thermal modalities, either by heating or by freezing you are causing myocardial damage. In pulse field ablation, you are not using heat energy here. So it's a non-thermal modality. So the myocardial cells are exposed to high voltage, so which causes irreversible pores in the cell membrane of the muscle cells, the cardiac cells. So this irreversible pores eventually cause irreversible injury. So this process is called as electroporation. So electroporation means creation of irreversible pores in the cell membrane and thereby causing cell injury. So the most important advantage of pulse field ablation is that it is at the particular voltage which we use, it is quite selective for the cardiac muscle. Another couple of minutes can I take? Yeah. So it is selective for the cardiac muscle cells and it spares the esophagus and the phrenic nerve. However, some of the adverse effects include hemolysis. If the blood cells get electroporated, then there will be hemolysis and can cause myoglobinuria and acute kidney injury. I mean, these are very rare, extremely rare complications. And there can be coronary spasm also. So advantage of pulse field ablation is that the extracellular matrix is preserved. So the tissue architecture is not affected by pulse field ablation. So it is generally a less traumatic kind of a traumatic mode of ablation. So pulse field catheters, they come in different shapes. They come in flower shapes, they come in basket shape, they come as a spear. So all different kinds of shapes of catheters are available. So pulse field ablation has taken over AF ablation in the West, both in the Americas and the European continents. However, we are soon anticipating the launch of PFA in the next couple of years in India. So that would revolutionize the treatment of AF ablation. So this is another AF catheter, the pulse field catheter, where there is a basket catheter and there is a balloon inside the basket. So that prevents contact of blood with the electrodes, causing pulse field ablation. So this prevents hemolysis. So this is another exciting evolution in pulse field technology. So this was the randomized trial, the ADVENT trial, which showed non-inferiority of pulse field with respect to thermal ablation. However, we know that pulse field is much, much safer. There is no risk of damage to esophagus or the phrenic nerve. So in that sense, pulse field